Deep breath in and out.
Nice. You're quick. Can you do traction on my hips?
Yeah.
Thanks. Oh yeah, here at Kelstein Chiropractic, a la carte adjustments. Hey everybody, this is Dr. Warren here at Kelstein Chiropractic. I'm with our preceptor, Kendra, who just joined us back from chiropractic school, Logan University, where I went to school. Kendra worked here for a few years as a chiropractic assistant, and she's back. She's going to be doing 8 months of work with us, and hand in hand, going to be seeing patients, going to be working with people. She's already been in clinic for over the past year, and Kendra's been awesome because she's stepped into a lot of different roles and studied under a lot of different providers. She's already dry needle certified coming back here. She'll be doing that 8 months from now. Super excited for her to have her on the team. And I'm also excited personally because Kendra's going to be taking care of me today. So I'm going to show you a video today of what it's like to get treatment when you have an aggravation to a disc. I've got some discogenic pain happening. My work is very physical, but I actually aggravated it lifting in a way that I don't normally lift. I was doing a leg press. I played lacrosse in college, and I've had some injuries to my lower back playing sports. And I use chiropractic care, I use dry needling, I use shockwave, and I use fitness to help my back stay healthy and in a good shape. But I definitely just overstressed it. I went a little too hard in the gym. My brother-in-law was a lot stronger than me. I was trying to be tough and keep up with him. And that's what happens when you try to do that. So I was like, hey, Kendra, before I go, I've got a little problem that I want you to help me out with. So she is just in the process of examining me. Kendra, first off, enough about me. Welcome back.
Thanks.
I'm so excited to have you here.
I know, I'm excited to be here.
I get to work hand in hand with her coming back, and she's like just a hard worker, and it's so fun to be able to bounce things back and forth with her from an educational standpoint, as well as just to have collaboration in this practice. It's just an environment of learning, an environment of growth. We have an amazing team right now. So if you're in the Baltimore area, it is not just Kendra and I. We have 4 other chiropractors here. We have PT techs. We have massage therapists. We have an amazing team of people that support all of those individuals that are awesome, that help people out with different forms of back pain, neck pain, different injuries that we see in the musculoskeletal sense in a conservative manner. So we don't use drugs or medicine, but we're growing in that sense. So there's more work to be done in the summer. A little sneak peek, we are integrating our practice, and we're going to have a functional nurse practitioner that supports our office with regenerative medicine very soon, in less than a month, a little bit over a month.
Yep.
So, back to me. Back to Kendra. Welcome back.
Thanks.
All right, so let's go ahead and I'm going to follow your lead. Go ahead and
Sure.
take me through a lower back exam. And then she might look at my left heel a little bit. I've got some old lacrosse injuries in the heel pad there that I'm looking forward to getting worked on too. So
Nice. All right. First, I'm going to have you bend over and try to touch your toes.
So.
And are you having pain with that?
Yeah, that kind of pulls on me a lot. I'm kind of like tender over, but that goes into my right hip a little bit and my lower back. I feel it right in my SI joint area.
Sure. Okay. I'm going to have you extend as far back as you can go. Any pain there?
No, it feels really good when I extend. Walking, kind of like moving around, extension helps.
Okay. I'm going to have you extend back again, and I'm going to dip this shoulder and just apply some pressure.
Yeah, I feel it like it's not happy in there.
Okay.
That causes a little bit of that kind of achiness, referred pain into the glute, mostly in my spine though.
Okay, we're going to do the same thing, but we're going to go the other way.
So it feels good in that space. It doesn't feel like I'm getting jammed up at all. It feels like you're opening me up, taking pressure off that side. My left side feels a lot better than my right.
Okay.
That's a Kemp's test.
And I'm going to have you give yourself a big hug, and then I'll have you rotate to the right. There you go. Go ahead and go to the other side.
Okay.
Any pain with either side doing that?
No, it feels okay.
Okay.
Yeah.
Hands by your side, and I'll have you lean one way. Good. Go ahead and go to the other side.
Nice.
How you feeling both ways?
A little achy, but it doesn't really set me off too much. Overall, it's fine.
Okay.
Yeah.
All right. I'm going to bring the table up.
So it's been a while for people that watch our channel. If not, subscribe, check it out. We put a lot of good content out, and we have a really fun team here, and we get to share our journeys just in life, but in chiropractic, physical medicine, and we, if you have questions about some of the stuff you're seeing or your own problems, throw them below, and we'll do our best to kind of give you some good feedback. Yeah, Angie was working on me. I did my first triathlon not too long ago. Went actually really well, and so I was gonna do like a follow-up video. I just never got around to it. So sorry if you're kind of following that story, but it went well, and I've got more coming up this summer. Just kind of doing my own personal ones. One more through this company called Xterra, which is a pretty cool spot. So what are you doing now, Kendra?
I'm palpating to see if I can find a point of pain on you.
Yeah, you just passed it right in there, a little bit, like a half a centimeter north. Other north. There. And if you go in the spinous process a little bit more, there. Yep, that's tender. And then if you go, you can palpate like right and left at those segments that are like irritated, and like don't be afraid to push down and then go medial and get it. Yeah. So take your right hand and go anterior and go medial, and then slightly cephalic, and then you'll just feel a little bit of pressure. And then compare, like that to me is like really sensitive. So there's a nerve, the dorsal branch that comes out and innervates the facet, as well as the ligaments and tissues posterior to that segment. So you're like, how do you know that a person has a problem? Because that nerve sometimes sends a little signal and makes things a little tighter or hypertonic there, but they'll be tender too, and you can kind of start to pick that up over time.
Yeah. You said you have pain kind of going down as well, correct?
I do.
Check out his hips a little bit.
All right, so field hockey, college.
Yep.
Athlete. You started working here.
Yep.
Dr. Jeff's favorite CA ever. Don't tell the other CAs.
I won't.
Hard worker. Cool. So external, internal rotation. You're palpating. You're feeling maybe some tender spots. Oh yeah. My right hip is like on fuego.
Yeah.
So
I do want to check out that right heel. You said it is your right heel?
Left.
Left. Okay.
Yeah. You know what? Let's do this. Let's go through myotomes and slump test. You're gonna do a little nerve testing. Okay.
Sure.
And then, because this is a little bit more acute and we have a good idea what's going on, and you're going to see me tomorrow, you can retest this. We don't do reflexes, we don't do sensory. I don't think that we need to dive into that too, but just kind of go through your run. Whenever you have neuro, you're going to do myotome, reflexes, sensory, and then you're definitely going to do neurodynamic testing, right? You're going to see if there's any tension through slacking or stressing the nerve or helping them. And then we'll go through, normally we do McKenzie protocol for this type of a problem. We start there and then we work our way into the pain side of things as well. We want to start with McKenzie's because it teaches them and shows patients how they can really help their own back, as well as it's very therapeutic, and it'll make you adjust them way easier. It'll be easier to adjust their back, right? So that would be the protocol normally,
Okay.
So do your myotome testing from here.
Okay. I'm going to bring your leg up. I'm going to have you push into my hand as hard as you can.
You're so strong, Kendra.
And I'll have you push again.
Good.
Good. I'm going to have you kick up like you're kicking a soccer ball. Good. Pull down.
Nice.
Good.
And so good means I have full strength and resisting. You keep doing your thing.
Yeah. Pushing me like a gas
and we would
pedal.
rate that a 5. If there's weakness, we'd rate it a 4. If they can contract but not hold against pressure, they would be a 3. And then 2 or 1 are a little bit more like advanced, and we don't see a lot of those issues in here. If we see that, that's not a good thing. Okay, that's good. That just hurts.
Go ahead and push.
Yeah, good.
Good.
Dang, Zach.
Kick
beat
up.
me up, dude.
Good.
So he was doing this like ab workout at the very end. So we do 5 exercises, and we did 2 days of it. Right? You keep doing your thing.
Go ahead
I'm
and pull
following your
down.
lead. Yep.
Good.
And the last one was you took the battle rope and you hooked it on the back of the squat rack, and then you pulled your whole body up onto your shoulders.
Yeah.
And in a flat line, you had to lower your whole body down. And up. So it wasn't just your legs like doing like one of those. It was like from your shoulders down. Maybe that's what did it. It was
Might
so
have
hard.
done it, yeah.
I was like, oh yeah, that looks easy. I can do that. It was like flop, flop. All right, what else you got for me? Strength feels good?
Yeah, strength feels awesome.
Heck yeah, I love that for myself.
We'll do slumps test now.
What's slumps test?
Okay.
Slumps test is a way of creating increased intrathecal pressure. God, am I saying that right? I want to see if there's anything encroaching in that disc space or in that foraminal space where the nerves are exiting. If it is, it will show up on this, especially when someone's aggravated or irritated in that area. It's a nice sensitive test for this. Okay.
So I'm gonna have you bring your leg up. Good. And I'm gonna have you kind of slump down, almost like you're taking a bowel movement is how we call it. Take on some bad posture.
So I can't go very far, and I'm gonna lean from the hips first. My head is gonna stay on horizon, and then from this position, my chin is gonna come down. And this motion here, the only thing that's moving is my cervical spine. But it's tugging on the nerves all the way down.
Yep.
So the reason it's really important to differentiate this and then going straight down is because you might run into someone with just like tight hamstrings.
Sure.
But you're not increasing anything in the hamstrings when you move your neck. The only thing you're doing is tightening the nerves.
Yeah.
So if it increases the symptoms that they're feeling. Hey, we're rolling, we're back. I don't know where we left off there. We just had a little bit of a question about a patient. All right, that actually really bothers me. And that makes sense, kind of what I'm feeling, what's flared up on me, and that's why I'm thinking right now, before I even came in here, that I have an idea that it might be a little disc irritation.
Yep.
All good. We see it all day long. I'm excited that we have a team here to help me out. Kendra.
Yeah.
Cool. All right. So what to do next? Okay, so we did myotomes, we did our flossing. She's going to adjust my spine. It's really good to get your back adjusted when you have discogenic pain. It works. It helps with alleviate a lot of the pain, range of motion improves, and then I can do my things that I'm going to do out there a lot better, which are the McKenzie press-ups and extension work. We can go through that, but would you mind adjusting me first? I'm just such a creature of habit. I'm going to do that for you. Cool. Taking this off. All right, so left lateral flexion is a little cleaner, right is a little rough, mid-back, TL junction. You adjust left side first, right side second, and then if you were going to really work me over, you would do nerve flossing with psoas and piriformis. Traction on my hips and my low back. Right, and then you would do your thing.
All right, deep breath in, let it all the way out.
Oh, nice.
Deep breath in and out.
Nice.
One thing Dr. Angie does that I found also observing her while I've been here,
Yeah.
I really like that Dr. Angie grabs onto the ASIS and she does this like a little roll move
Yeah.
up the spine, and it really loosens up patients super well, I've noticed.
Oh no, that's a nice technique.
I know, I like that.
Do it. That's why we got like 5 different practitioners. Pick up different skill sets from different people. We all got our little habits and techniques and skills relative to that, and like hopefully we show you as much of that stuff that we know, and you take it and you help people.
Yep.
So that's a good one. I like the rib mode. I'm gonna come on my right side down. Is that cool?
Yeah, that's cool.
Yeah, Angie's got good technique.
She does.
So Angie's one of the new chiropractors in here. She's been working with us the last, God, man, not even that long. Has it even been a couple? It's been a couple months, full time, maybe a month. But she's already like got her own little patient group coming to see her. It's pretty cool to see how quickly she's gotten busy. Nice. You're quick. Seriously, your line of drive is like, it's right there. It's good motion. You set me up nicely. Good job. So relative to like reps and manipulation and time, like Kendra's gonna get a ton of it in the next 8 months. A ton of it on me too, hopefully.
Oh yeah.
Oh man, goodness. I'm gonna stop talking. Good. That was better. Line of drive was good. It went through, the force went through the area that you were trying to manipulate, and honestly, it's good positioning. You'll roll me more, and you'll pull more with your arms. It'll be more of a full body activity.
Yeah.
And you'll be relaxed while you do it as you're doing it. But that's a good start.
Yeah.
Good job. And can you do traction on my hips?
Yeah.
Thanks. Oh yeah, here at Kelstein Chiropractic, a la carte adjustments. Nice. Good job. So, and you're strong. I'll never forget, like, I was not as forceful and firm with my adjustments as Kendra is right now.
Really?
Coming out of school. Yeah, I think you're just naturally strong. You have good hands. Thank you, Kendra.
You're welcome. I'm sweating.
Wow. Appreciate you. I'm so grateful that she's here. She's going to do some dry needling on my low back, some shockwave on my heel, and we're going to do that tomorrow because I have to run home to my kids that are running around the house right now. And my wife's like, "Where are you?" So I got to go. But thank you very much. Of
course,
appreciate
anytime.
it. We'll be doing some videos with Kendra. We'll be talking about maybe some of my problems because I think that they're relatable. I know they are. They're very relatable to our patient population. And then showing you some ways to really help yourself on our YouTube channel, as well as to just doing some group learning. Like Kendra will be real. Like she's finishing up school right now. She's still learning. Heck, I'm still learning. So we're gonna apply some new things. We're gonna learn together, and hopefully we'll teach you some things along the way. So thanks for watching. And if you're in Baltimore, come on down. Let us help you. Cool.